Welcome to EduRev. Today we're going to talk about something that's way more important than just rules and regulations. We're talking about building the absolute bedrock of your future career in medicine or dentistry. Seriously, this isn't just about passing your course. It's about becoming the professional your future patients will literally put their lives in the hands of. So let's get started building that foundation together.
So let me ask you a question. Just think about it for a second. What's the number one skill you need? Is it your diagnostic genius, maybe your steady hand in surgery, or that huge encyclopedia of pharmacology in your head? All of those are absolutely critical, no doubt. But what's the one thing that holds it all together?
You guessed it, it's your integrity. Think of it like the operating system that runs everything else. Without integrity, all that amazing knowledge and all those incredible skills, well, they're built on shaky ground. Your integrity is what earns you the trust of your patients and your colleagues. And let me tell you, that trust is everything.
All right, so how do we build this foundation of integrity? We're going to do it with 4 essential pillars. Let's dive right into the first one, mastering collaboration. Now, you might think that group work in university is just, a chore to get through, but it is so much more than that. This is what's so cool about this. That group project that you might be dreading, it's your first real simulation of a clinical team. In a hospital, you never work alone. Your team is your lifeline, your safety net, your sounding board. How you learn to communicate and work together right now directly predicts how effective and safe you're going to be later on. And it all boils down to something pretty simple. On one side, the do's, collaborate fairly and respectfully. But look at the don't side. Making unilateral decisions, that's not just poor teamwork, it's dangerous. In a hospital, that's like a surgeon completely ignoring a warning from the anesthesiologist. It breaks trust, and it puts a patient's life at risk. This is where you practice making sure that never happens. And here's what that looks like in the real world, right now. These aren't just, nice suggestions. These are professional expectations. Collaborating with respect, communicating like a professional, and taking responsibility for the group's learning, this is where you prove you have what it takes to be part of a team that people can count on. Okay, let's move on to our second pillar. And I want to be really clear here. We're now talking about the ethical red lines. These are the absolute 100% non-negotiables of your profession. The definition you see here leaves no room for doubt. Any action that gives an unfair advantage is academic misconduct. It's not a gray area. Just think about it. If you fudge the data on a university lab report to get a better grade, what's to stop you from misreading a patient's lab results down the line because it doesn't fit with what you thought? The habit of being honest with facts starts now. And look at how clear this line in the sand is. On one side, you have honest engagement. On the other, you have actions that completely shatter trust. There is no middle ground here. As a future doctor or dentist, your work has to be beyond question. And that high standard begins right now, with every single assignment you do. This is so important. Your responsibility here is active, not passive. It is not enough to just not cheat. You actually have a professional duty to never participate, to never cover it up, and to know how to speak up when you see something wrong. Staying silent when you see misconduct, that's just not an option. All right, pillar number 3. This one shifts the focus directly onto you. This is about moving from being a passive student who just receives information to being the active driver of your own education. It's all about taking ownership. Think of these 4 steps as your personal roadmap. Ask yourself, are you just showing up or are you fully engaging? Are you just hearing feedback or are you actually using it? Are you waiting to be told what to learn next, or are you out there proactively finding ways to get better? You are the one building your own competence. I absolutely love this quote because it totally reframes something that, let's be honest, most of us fear. Let this one sink in for a second. Feedback isn't a personal attack. It's a gift. It's literally a map showing you exactly where you need to improve to become a better, safer professional. And that leads us perfectly into our 4th and final pillar. Actually using that blueprint. This is all about actively walking the path to growth by mastering how you take feedback. I'm telling you, this one skill can literally define the entire trajectory of your career. Look at this. This choice right here is one you are going to make thousands of times in your career. You can choose to be open, to listen, and to learn. Or you can choose to get defensive and just shut down that opportunity to grow. Only one of those choices leads to being excellent at what you do and keeping your patients safe.
So really, it all comes down to this four-part cycle of growth. You listen openly, no excuses. You go away and reflect on what was said. You actually implement the changes. And then, this is the most important part, you proactively go out and ask for more feedback. This is the engine of continuous improvement that every great clinician runs on. All right, we've built our 4 pillars: collaboration, honesty, ownership, and growth. So let's pull it all together into a simple, powerful checklist you can use as your guide day in and day out. I want you to look at this as your personal commitment, your professional pledge. Don't just read the words. Frame them as I will statements. I will collaborate fairly. I will be honest. I will take ownership. I will seek growth. This is your personal blueprint for a career defined by integrity. Now, this commitment to excellence, it starts way before you even set foot in medical or dental school. If you're serious about laying the strongest possible foundation, especially for a monster exam like the UCAT, you've got to have the right tools. You can continue this journey on the EduRev app. It's packed with all kinds of resources to help you get ready and succeed, and it's available for you right now on both the Play Store and the iOS App Store. So go ahead and check it out. So I'm going to leave you with this final question, and I really want you to think about it. This isn't just a topic we covered. It's a choice you have to make every single day. Look at this question on the screen. How will you make integrity the absolute cornerstone of your future practice? Your career, and more importantly, your patients, are depending on your answer.